Pamela asking about strabismus, newly suffering from this. So strabismus means the two eyes are split. They're not working together. But meaning that the two eyes aren't working together, it also means there's a split in the brain and a lack of integration in the body, and there's a confusion in the midline, the middle. So obviously the last thing you want to consider in strabismus is strabismus surgery. It doesn't work. It changes the length of the muscle, but the source of being able to direct your eye muscles takes place in the brain. So you have to reprogram the brain in directing the eye muscles, and then the strabismus will go away. I would consider doing some of my eye exercises around the eye patching, the eye dialogue, the animal eye chart. In other words, you're going to disrupt your current strabismic pattern, which is a conflict between the two eyes, by allowing each eye to do its own thing. Stress is a big issue with strabismus, so maybe getting some craniosacral therapy, doing some cross-patterning things like walking the right arm and the left leg and left arm and the right leg. So doing cross-patterning movements, walking forwards and backwards, really going slowly in the cross-patterning. Cross-patterning can sometimes help heal strabismus. Being very careful about the lens prescriptions you're getting. I would caution you about using any kind of prisms, except the ones that I talk about called yoked prisms. I also would stay away from things like progressive lenses or bifocals and only use a single vision lens. And, if you start those particular things, I actually have a 90-day program on my website for strabismus double vision, Pamela, and you could use that as a way to integrate your two eyes, brain, and body together.
If you like this video, hit the subscribe button and turn on your notifications. Please send your comments to me. I'd love to hear from you.